Two things today. Biology is amazing and I'm glad I was born in Russia. Why, you say? Well, researchers from New York Institute of Technology published an article in medRxiv showing a correlation between universal BCG vaccination policy and reduction in morbidity and mortality for COVID-19 patients. It's a very interesting correlation. I did see previously that some countries have a lot less COVID-related deaths than others. These researchers point out that countries without universal policies for BCG vaccination, like Italy and Netherlands and America, have been statistically significantly more severely affected compared with the countries with this universal policy, such as Russia. BCG vaccination also seems to protect the elderly population, so the earlier the policy was implemented, the better. I leave links to the paper down in the description. I urge you to take a look at this yourself and form your own conclusions. I'm just giving you an overview of what I thought when I was reading this. This paper claims that Italy did implement strong curtailing in social interactions. However, as we all know, COVID mortality is still high. In Japan, apparently, the social isolation policy is not as strict, but the number of deaths is less than that in Italy. BCG vaccination is originally developed as vaccine for tuberculosis, and it's not really implemented equally all over the planet. For example, the United States, a fairly large country, doesn't have this universal vaccination policy. In one of the studies, children vaccinated with BCG were observed to have 50% reduction in overall mortality, and it was attributed to the vaccine's effect on reducing the respiratory infections, which is the problem in COVID-19 patients. The study, which again I urge you to look at yourself, took data from the BCG World Atlas and compared it with current as of March 21st data on COVID-19 cases. The main point of the study is that countries that have current universal BCG policy have significantly less deaths per million people, 0.78 versus 16.4 per million people in countries without the universal BCG policy. This is a very interesting study, primarily pointing out that BCG vaccination might offer some long-lasting protection to those who have been vaccinated in countries that regularly vaccinate. Authors urge you to not make any hasty conclusions, as a larger clinical study needs to be performed to assess the overall effects of such vaccination, but the results are very interesting and they point to the reasons why we observe some differences between these countries. Let's keep working.